Hello everyone, we are discussing the anatomy of the head and neck. In this video, we are going to talk about cranial nerves. So there are 12 cranial nerves, and the mnemonic to remember the functions of the cranial nerve is some say marry money, but my brother says big brains matter most. This mnemonic is used to describe the function of the cranial nerve, whether the cranial nerve is sensory or motor or a mixed nerve. The first cranial nerve is olfactory nerve. It arises from the olfactory nerve cell in the upper part of the nasal mucous membrane above the superior concha. The bundle of these nerves pass through the openings in the cribriform plate of ethmoid bone and they enter the olfactory bulb inside the skull. The olfactory bulb is connected to the olfactory area of the cerebral cortex by the olfactory tract. The next is optic nerve that arises from the cells of the ganglionic layer of retina and leaves the eyeball in the orbital cavity and passes through the optic canal to enter the middle cranial fossa. It unites with the optic nerve of the opposite side to form the optic chiasma. So it's important for you to remember that the fibers from the medial half, which is the nasal half of the retina, they cross the midline and enter the optic tract of the opposite side, whereas the temporal side of retina remain there and remain at the same side. Most fibers of the optic tract they terminate by synapsing with the nerve cells in the lateral geniculate body, which is a small projection from the posterior thalamus, and few fibers they also pass to the pretectal nucleus and the superior colliculus of the midbrain. However, and are concerned with the light reflexes. The axons of the nerve cells of the lateral geniculate body pass posteriorly as the optic radiation and they terminate in the visual cortex. Okay, the next is the oculomotor nerve, which is a third cranial nerve. It emerges on the anterior surface of the midbrain and passes forward in the lateral wall of the cavernous sinus. It divides into superior and inferior rami, which enters into the orbital cavity through superior orbital fissure. So it supplies the extrinsic and the intrinsic muscles of the eye. The intrinsic muscles includes the constrictor pupillae of the iris and the ciliary muscle. These fibers synapse in the ciliary ganglion and reach the eyeball in the short ciliary nerve. Trochlear nerve is the fourth cranial nerve and is the most slender of the cranial nerves, and having crossed the nerve of the opposite side, they leave the posterior surface of the midbrain. And then it also runs as the oculomotor nerve in the lateral wall of the cavernous sinus and enters the orbit through the superior orbital fissure, and it supplies the superior oblique muscle. The mnemonic to remember this is SO4. It is entirely motor and it assists in turning the eye downward and laterally. The fifth cranial nerve, which is the largest cranial nerve, is trigeminal nerve. It leaves the anterior aspect of the pons as a small motor root and a large sensory root, and then it passes forward out of the posterior cranial fossa to reach the middle cranial fossa, where the sensory root forms the trigeminal ganglion that lie within the dura metal called the trigeminal cave. There are three divisions of trigeminal nerve: the ophthalmic, maxillary, and mandibular nerve, which arise from the anterior border of the ganglion. The ophthalmic nerve is entirely sensory. They run forward in the lateral wall of the cavernous sinus and divide into three branches: the lacrimal, frontal, and the nasociliary nerves. Lacrimal nerve join the branch of the maxillary nerve that contain the parasympathetic fibers to the lacrimal gland. The lacrimal nerve then enters the lacrimal gland and give off branches to the skin and conjunctiva of the upper eyelid. Then the next branch is frontal nerve, which is a branch of ophthalmic nerve that divide into supratrochlear and supraorbital nerves. Then we have nasociliary nerve that continue as the anterior ethmoid nerve and enters through the anterior ethmoidal foramen to enter the cranial cavity. It gives off two internal nasal branches that supply the skin and tip of the nose with the external nasal nerve. It also gives branches to the ciliary ganglion, long ciliary nerve that contains sympathetic fibers, infratrochlear nerve, and a posterior ethmoidal nerve. The maxillary division is purely sensory and it emerges from the foramen rotundum and enters the orbit to the inferior orbital fissure, then continue as the infraorbital nerve. In the infraorbital groove, it emerges on the face to this foramen and gives sensory fiber to the skin of the face and the side of the nose. Other branches are meningeal branches, the zygomatic branch, the ganglion branch, and the posterior, anterior, middle, superior alveolar nerve. Then we have the pterygoparietal ganglion, which is a parasympathetic ganglion. It is suspended from the maxillary nerve in the pterygoparietal fossa. It is secretomotor to the lacrimal and nasal glands. The mandibular nerve, which is a branch of trigeminal nerve, is both motor and sensory. It emerges from the foramen ovale. It has small anterior and large posterior division, and its main tongue branches include the meningeal branch and the nerve to the medial pterygoid muscle, which also supply the tensor villi palatini. So the tensor villi palatini, the nerve supply, is the mandibular division of the trigeminal nerve. Then the branches from the anterior division is a masseteric nerve that supply the masseter muscle, deep temporal nerve for the temporalis muscle. Then there is a nerve to the lateral pterygoid muscle, the buccal nerve. The buccal nerve, it's important for you to remember that it does not supply the buccinator muscle. The buccinator muscle is supplied with the facial nerve. It is the only sensory branch of the anterior division of the mandibular nerve. Then the posterior division gives the auriculotemporal nerve, lingual nerve, and the inferior alveolar nerve. The lingual nerve also gives of the it is joined by the chorda tympani nerve, and it supplies the mucous membrane of the interior 2/3 of the tongue and the floor of the mouth. Then we have two ganglions, submandibular ganglion and the otic ganglion. The submandibular ganglion is a parasympathetic ganglion that lies deep to the submandibular salivary gland. It has preganglionic parasympathetic fibers that reaches from the facial nerve via the chorda tympani and the lingual nerve, and the postganglionic fibers they pass to the submandibular and the sublingual salivary gland. Otic ganglion is a parasympathetic ganglion. It lies medial to the mandibular nerve just below the skull. The preganglionic fibers originate in the glossopharyngeal nerve and they reach the ganglion via the lateral petrosal nerve. The postganglionic secretomotor fiber reach the parotid gland via the auriculotemporal nerve. The reducing nerve is a very small nerve that leaves the interior surface of the brain between the pons and the medulla, and it passes forward to the cavernous sinus with the internal carotid artery and then enters the orbit through superior orbital fissure, and it's apply the lateral rectus muscle, so it's responsible for turning the eye laterally. Facial nerve is a mixed nerve and it lies between the pons and the medulla oblongata and enters the internal acoustic meatus with the vestibulocochlear nerve, then enters the facial canal and passes laterally to the inner ear. On reaching the medial wall of the middle ear, the nerve swells to form the geniculate ganglion, and then it has a course in the middle ear, and then it emerges from the temporal bone to the stylomastoid foramen. The facial nerve lies in the parotid salivary gland after leaving this foramen and is located between the superficial and deep part of the gland, and give off terminal branches that pass the muscle of the that pass to the muscles of the face and scalp. So in this slide, it's important for you to remember that the anterior 2/3 of the tongue is supplied by the chorda tympani nerve, which is the branch of the facial nerve. The posterior auricular, posterior belly of digastric, stylohyoid nerves are other muscular branches, and there are 5 terminal branches, that is temporal, zygomatic, buccal, mandibular, and cervical branches. The buccal branch that supply the buccinator muscle, and the cervical branch supply the platysma and the depressor angular oris muscle of the face. Vestibulocochlear nerve, it's very simple, it's sensory nerve, and it has a vestibular fiber that are concerned with sense of position and with the movement of the head, whereas cochlear fiber are concerned with hearing. Glossopharyngeal nerve is a mixed nerve that emerges from the medulla oblongata between the olive and the inferior cerebellar peduncle. It leaves the skull to the jugular foramen and it winds around the posterior border of the stylopharyngeus muscle to be distributed to the pharynx and the tongue. Branches of glossopharyngeal nerve: the tympanic branch, the carotid branch, the nerve to the stylopharyngeus muscle, the pharyngeus branches, and the lingual branches that passes through the mucous membrane of the posterior third of the tongue, including the velate papillae. This nerve is also a mixed nerve and it descends vertically in the neck within the carotid sheath. There is with the internal jugular vein and the internal common carotid artery. It then descends through the thorax and the mediastinum and passes behind the root of the tongue, and it enters the abdomen through the esophageal opening in the diaphragm. The vagus nerve has the most extensive distribution of all the cranial branches. They contain nerve fibers from the cranial root of the accessory nerve that joins the pharyngeal plexus and supply all the muscle of the pharynx except the stylopharyngeus muscle that is supplied by the glossopharyngeal nerve, and of the soft palate except the tensor villi palatini that is supplied by the facial nerve. Then there is external and the internal laryngeal nerve. The internal laryngeal nerve is sensitive to the mucous membrane of the piriform fossa and the larynx down as far as the vocal folds. The larynx below the vocal fold is supplied by the recurrent nerve. The external laryngeal nerve is motor and is closely related to the superior thyroid artery, and it supplies the cricothyroid muscle, whereas all the other muscles of the larynx is supplied by the recurrent laryngeal nerve, and the recurrent laryngeal nerve is related to the inferior thyroid artery. Moreover, on the right side, the recurrent laryngeal nerve hooks around the first part of the subclavian artery, whereas on the left side, it hooks around the arch of the aorta. Nerve is motor nerve with cranial and spinal root. The cranial root emerges from the medulla oblongata, whereas the spinal root arises from the nerve cell in the anterior gray column of the 5 segment of the cervical part of the spinal cord. The spinal cord supplies the sternocleidomastoid muscle and crosses the posterior triangle of the neck to supply the trapezius muscle. Therefore, the accessory nerve bring about the movements of the soft palate, the pharynx, and the larynx, and also control the movement of the 2 large muscles of the neck, which is trapezius and sternocleidomastoid nerve, which is the last cranial nerve, and it's a motor nerve that emerges on the interior surface of the medulla oblongata between the pyramid and the olive. In the upper part, it is joined by C1 fiber from the cervical plexus. The hypoglossal nerve proper supply most muscle of the tongue and control the shape and movements of the tongue. The descending branch is C1 fibers that join the C2 and C3 and form the ansa cervicalis that supply the omohyoid, sternohyoid, and the sternothyroid muscle. The thyroid muscle is supplied by C1. All muscles of the tongue are supplied by the hypoglossal nerve except the palatoglossus that is supplied by the pharyngeal plexus. Then there is a nerve to the geniohyoid, which is C1. To discuss in this video is cervical plexus formed by the anterior rami of the first four cervical spinal nerve, and the branches are lesser occipital nerve, the greater occipital nerve, the transverse cervical nerve, the supraclavicular nerves. The supraclavicular nerves are important because the pain may be referred along them from the phrenic nerve in case of gallbladder diseases. The phrenic nerve is the motor nerve supply to the diaphragm, which is the only motor nerve supply. It runs down the neck on the anterior surface of the scalenus anterior muscle and enters the thorax by passing anterior to the subclavian artery. For the cranial nerves, it's very important for you to remember the where these cranial nerves are emerging from and the important branches and the nerve supply, which muscles are supplied by which nerves, which are very important for the MCQs. Thank you for watching.